Hello, everyone. My name is Kevin, and I'm an acupuncturist at Center of Balance, and we're based in Dinsdale, Hamilton, and Auckland, Riverlea. We have two centers, so we can help you deal with a lot of pain and discomfort in your body. It doesn't matter if it's chronic or acute. We can help. So if you know anybody who is needing some help and treatments, please don't hesitate to spread the word with your friends. So, hi everyone. My name is Kevin, and I'm from Center of Balance. We're based in Riverlea, Auckland, and Dinsdale, Hamilton. So we do acupuncture as well as herbal medicine, Chinese herbal medicine. So if you know anybody who needs help with pain management or any discomfort, regardless if it's chronic or acute, we can help. So please spread the word for us, and we love to help some people in the community. So today I am going to talk about knee pain. Around a couple of weeks ago, I talked about the what is knee pain, and also we talked about the causes of knee pain. So let me just do a little bit of recap on the causes of knee pain. So I will start with talking about the Western medicine's perspective on knee pain. And then once I finish that, I will talk about the Chinese medicine's perspective on knee pain. Okay, so knee pain is okay. Hi, Anderson. Is that how you say your name, Anderson? Hi, thanks for tuning in to watch the live talk. So we're talking about knee pain. I'm sure you probably experienced knee pain at some stage in your life. I certainly have lots of experience at being quite active and exercise a lot. I frequently had knee pain. So it is good to learn about how to deal with these kind of things. So I'm going to talk a little bit about the Western medicine's perspective first, then we're going to Chinese medicine, okay? So many people experience knee pain, and knee pain can actually appear out of nowhere. It doesn't have to be caused by an injury. Because our body is actually, our knee is actually a very delicate structure. It consists of many parts. So because it is such a delicate area, it is very prone, very easy to get stretched out or get worn. Like if you repeat a certain motion a number of times, the cartilage gets worn or gets aggravated, like get inflammation, swollen, or you have ligaments, the ACL, anterior cruciate ligaments, ACL, and posterior cruciate ligaments. So these can actually become torn, like partially torn, or in some cases it's completely torn, or they are fluid capsules that actually protects knee that can actually become ruptured if there's excessive pressure on the knees. Okay? So it doesn't actually take a traumatic blow or severe injury for your knee to become injured. Okay? So it could be caused by fracture, tendonitis, excessive sports like runner's knee, torn ligament, osteoarthritis, bursitis, injured meniscus, gout, or infectious arthritis. These can all cause knee pain. Okay. Although despite knee pain being very common, you don't need to be too worried, because minor knee pains can be actually looked after at home and heal without actually having to go to the hospital or go and see a doctor. There are plenty of home remedies that can actually help you recover from knee pains. And of course, acupuncture, we do needling to help with knee pain. You don't actually need needles either. If you know which points to press at home, you can actually alleviate your knee pain without using needles. You just find the points and then just give it a good rub or massage, and it can actually help knee pain quite effectively. The other type of knee pain is chronic knee pain. So chronic knee pain, on the other hand, is a bit harder to treat because it's been there for a while, and you probably have tried many things and it just doesn't go away. Okay, so it actually requires proper treatment. It isn't always attributed to one incident. It could be a number of causes that compound together and causes a chronic knee pain condition. Okay, so physical conditions or diseases can cause knee pain as well, and these includes osteoarthritis, pain and inflammation in the and in destruction of the joint caused by degeneration and deterioration of the joint. You have tendinitis, which is pain mostly appear in front of the knee, that is made worse by when climbing, taking stairs or walking up an incline. You have bursitis that can cause chronic knee pain. It's an inflammation caused by repeated overuse. Things like gout can also cause knee pain. It's an arthritic condition caused by a buildup of uric acid. Then you have rheumatoid arthritis, which is a chronic autoimmune inflammatory disorder that can cause pain and swelling, can eventually cause the joints to deform and erosion of the bones in the joint. And then you have dislocation of the kneecap, most often caused by trauma. And meniscus tear, a rupture in one or more of the cartilage in the knee. Okay, these are all quite common causes of chronic knee pain. Or you can have torn ligament. Yep. So okay. So I want to talk about how actually knee pains are diagnosed as well. So we've just talked about the causes of knee pain. Let's talk about the diagnosis of knee pain. So how do you diagnose chronic knee pain? So each possible cause of chronic knee pain requires different diagnostic testing. These includes blood work, physical examination, X-ray, CT scan, or MRI, and other imaging tests. The condition of your doctor thinks you have will determine the type of test you will undergo to see what the causes of your chronic knee pain. On the other hand, diagnosing and testing for sudden knee pain. So unless the sudden knee pain clearly results from an injury or accident, or the pain is severe, most people can actually wait at home for a few days before seeing a doctor. During this time, people should avoid or limit any activities that causes discomfort. So you can use resting, applying ice pack, and using non-steroidal anti-inflammatory drugs such as ibuprofen can provide relief. Symptoms may start to improve. However, this does not always happen. So if it doesn't happen after resting, you might want to approach your doctor and say, hey, can I please get some help? So the doctor will have a look at your medical history and have a look at your history of activities to see if you're really active or you do a lot of sports, those kind of things. And then the doctor will manipulate your leg to check your pain, tenderness and swelling, and then assess your range of motion of your leg knee movement. And then they might ask you to do like imaging such as MRI scan or X-ray to determine what is causing your knee pain. So going to the Chinese medicine's perspective on knee pain. So to discuss knee pain from a Chinese medicine's perspective, we must understand that they are meridians, the phenomenon of meridians. So they are actually altogether 6 meridians that runs up the leg, okay? So I got a figure of a human body. So on the outside and the back side, you have the 3, what we call the 3 young meridians. These are the bladder meridian, the gallbladder meridian on the side of the leg, and the stomach meridian runs along at the front. Okay, so these are all the 3 young meridian. Young means the outside, okay? The outside meridians traveling up the body. And then on the inside, which is the inside, okay, you have the spleen meridian, you have the kidney meridian, runs from under the feet up the inner side of the leg, and then you have the liver meridian, which is between the first and second toe, and runs up on the inner side of the leg as well. So altogether, there are 6 meridians that actually runs up the leg, and of course, obviously, it runs past the knee as well. So just because the meridians can be seen doesn't mean that they don't exist. And from working at Center of Balance, I have seen time and time again that meridians actually can actually exist. We can prove its existence because we needle based on the meridian theory, and to see if actually the pain will actually dissipate or lessen or disappear. And many times it does work. Okay, so I can personally attest to the meridian theory. It actually works and it exists. Okay, so you have 6 meridians. So when we encounter a knee pain, it is most important to understand where is the knee pain. Okay, don't just get fooled by or get confused by the name of the disease. Now, ask yourself, where is the knee pain? Is it at the front, on the side, on the inner side, or on the back? Because that is critical in diagnosing what type of knee pain it is, okay? And how to treat it. If it's at the front, it has more to do with the stomach meridian, yeah? If it's on the side, then it has to do with the gallbladder meridian. It's on the back, it's more to do with the bladder meridian, or if it's in the inner side of the leg, then it's got more to do with kidney, spleen, or liver. Okay. And there's pain, and it may be due to a trauma. It might be caused by a trauma at the start, causing the energy to be blocked because the trauma or injury has made the meridians to be blocked. So the chi and blood, the energy and blood cannot flow, and then it causes pain. Okay, so there's another cause to pain as well. this might, so as I mentioned before, it might be due to a trauma or injury that causes the meridians to be blocked. Another type of pain is caused by a deficiency nature. Okay, so deficiency, what does that mean? It means that the organ system, like the bladder meridian or the stomach meridian at the front, is becoming weak. So weak means that it's the chi or the blood is not enough anymore. So the things don't flow enough. It doesn't flow smoothly. It's like a hose. Okay, when you turn there's two reasons why the water won't come out from the hose. One is you kink the hose, and so the water doesn't get through. It's blocked there. So that's caused by injury, right? The second type of pain is caused by the second reason why the water won't come out of the hose is because the water is actually not turned up enough. So there's no water coming out. So you got to turn on the tap enough for the water to spill out, right? So this is known as the deficient type. There's not enough energy for the flow to occur. So it becomes stagnant. Yeah, does that make sense? So please ask any questions if you don't understand what I'm talking about. If there's anything that I'm talking about that you don't understand, you can ask me. Okay. So in Chinese medicine, we have to understand two things. One, where is the pain occurring? Two, what is the nature of the pain? Is it caused by an injury or a deficiency? Okay. How do you tell if it's caused by injury? So the pain coming from injury is usually sharp or severe, acute pain, okay? Stabbing pain. Now, the pain caused by deficiency is usually a dull ache. Usually that is chronic in nature. It's been there for a while and becomes dull ache, okay? So that's how we actually tell the difference. Okay, so that's the theory for you to understand. Now, I want to go into how actually Chinese medicine can help you, and I want to give you some pointers. So, excuse me there. Last time I actually talked about a really useful point for you to do it yourself at home to manage your knee pain. And that point, I will just repeat that again. It's actually, this is your palm, okay? So put your palm, the center of palm, on the kneecap, and that point, the thumb, where the thumb lands, there's a tendon there. And that tendon is about a thumb's width. You can actually rub this point to help with your knee pain. Okay? Now, today I'll give you another point to work at home to help with your knee pain. That point is actually located behind the knee, okay? So if you are standing here, okay, I'm just going to create some space. If you're standing there, you can feel there's actually two tendons at the back of your knee. Now, the point you want is actually in between the two tendons, okay? So, see, there's two tendons that runs along here. They're actually quite pronounced, quite easy for you to feel. And the point is in the center, not on the tendons, on the center behind the knee. And quite often, if you have knee problems, you can actually feel there's a knotty bit on the tendon. Something just doesn't feel quite smooth. And when you actually massage it, you can actually feel this pain there. and you want to massage that quite often to be able to help with the knee. Okay, so massage that often at home. You can spend a minute or two just rubbing each day, you know, whenever you have time, and just rubbing that area and just get that nice and loose, and that will also be able to help you with knee pain. So what else can you do? One extra point I want to give you. That point is actually located at the top. So this is your kneecap. On the top of the kneecap, okay, just behind, not on the kneecap itself, but the top of the kneecap and just a little behind, there's actually another point here you can actually massage at home to help with your knee pain. Okay, just right at the top of the knee. And that is that point is called Heding. Okay, you can use that point to help you alleviate knee pain. So, yep, that is about it. So if you have any questions, please don't hesitate to ask. Okay, so I will finish the broadcast here, and thank you very much for tuning in again. And I will do another live talk maybe in a couple of days' time, and please tune in again or watch the replay, and I will give you some more pointers on how to alleviate your knee pain if you have a knee pain by yourself at home. Alternatively, if you cannot get any relief, if you feel it's really stubborn, give us a call. Okay, so our number is, let me see, is 07. Can you see that? 07, that's not very clear. 07 846 7956. That's for Central Balance in Hamilton. And or you can alternatively you can Google us. Just put in Central Balance Dinsdale Hamilton or Central Balance Auckland Remuera. You can find us online as well. Give us a call. Let us help you. Okay. All right. Thank you very much for watching again. I will see you in our next session, and be sure to tune in for some more tips. Thanks. Bye.